Hello, I'm Dr. Damla Altın, your instructor for this chapter, Personal Hygiene and Strategies. Over the course of our lessons, we will address the teaching of personal hygiene skills to individuals with intellectual disabilities. And during these 4 lessons, we will learn importance of the hygiene skills and types of hygiene skills, assessment of hygiene skills, teaching strategies, and sample teaching of hygiene skills. Today, we are going to talk about the importance of personal hygiene skills for individuals with intellectual disabilities and which hygiene skills can be taught for them. By the time you finish this session, I hope that you will define the hygiene, you would explain the importance of hygiene skills for individuals with intellectual disabilities, and also you would explain which hygiene skills can be taught to individuals with intellectual disabilities. So let's start the definition of the term hygiene. As you can see on the screen, hygiene is a health term and could be defined as practices performed for protection from circumstances detrimental to health and the cleaning measures taken in their support. Hygiene skills are so important for our lives, and maintaining a healthy life can only be achieved through personal hygiene practices. There are tons of benefits of personal hygiene, and personal hygiene ensures our comfort, safety, well-being, health, and enable us to live a happy life. So if we fail to maintain personal hygiene skills, our quality of life is significantly impacted in a negative way. So that's why these skills are so important for in our lives. But these skills are crucial for people with intellectual disabilities. So why is that? Why these skills are so important for people with intellectual disabilities? And let's answer this question for a couple of factors. And the first factor is independent living skills. The underlying principle behind the services provided to individuals with intellectual disabilities is to equip them with independent living skills. For example, we want them to dress themselves and cook themselves or go shopping without any help or assistance or just a little bit assistance. So personal hygiene skills are one of the skills, and some personal hygiene skills are used on a daily basis. Some of them we use it. We do it for a few times in a day or for a couple of times in a week. So considering that personal hygiene skills need to be regularly practiced, it's very crucial for individuals with intellectual disabilities to acquire these skills. If these people cannot acquire these skills, their dependency on others decreases. Moreover, they can lead their lives without the need for assistance from anyone. So we don't want them to dependent all the time for a person. We don't want that. We want them to live independently. So that's why we have to teach these personal hygiene skills, because they are doing for many times. So it's very important for them. And the second factor is protecting personal and community health. Having skills such as hand washing, brushing teeth, and bathing is essential for protecting ourselves from infections, diseases, and health complications such as tooth decay. And also it plays a crucial role in preserving individual health and preventing the spread of illnesses within the community. So For example, if there's no habit of using tissue paper when sneezing and coughing, it can easily lead to the transmission to viruses to others. And considering that individuals with intellectual disabilities may not acquire all these skills adequately through mere observation, it becomes crucial to specifically teach them these skills benefiting for both themselves and also society. And the third factor is social inclusion. Let's imagine that you are on the subway and there's a person who smells very bad, who looks very dirty, and people tend to be far away from this kind of people. So if our students or if people with intellectual disabilities are like this, they can not communicate with other people, they cannot socialize. So these normative behaviors are very important for these people to become the part of a community. So that's why we teach these skills for them. These three factors I mentioned make it vital for individuals with intellectual disabilities to acquire personal hygiene skills. So which hygiene skills should we teach? Actually, there are many hygiene skills, but we will focus on common core personal hygiene skills here. These skills are hand washing, toilet, oral hygiene, bathing, armpits, nail, food, shaving, menstrual, dressing, coughing, and of course, some other personal hygiene skills. And let's start with the, okay, I'm sorry. Yes, let's start with the hand washing. We wash our hands for many times in a day, and according to studies, we wash our hands 6 to 10 times in a day, approximately. And also, according to CDC, simple hand washing procedures could reduce the deaths by up to 50% and significantly reduce respiratory infections. And as you can see, gaining hand washing is crucial for individuals with intellectual disabilities, like everybody else. And you can remember that COVID-19, during the COVID-19 pandemic, we learned the importance of washing our hands very regularly. And I remember I was washing my hands all the time for many times in a day. I'm sure many people are like this. So that's another reason we should prevent ourselves from the pandemic and other viruses and bacteria around us. And second personal hygiene skill is toilet. Toilet skills is one of the daily activities of practical adaptive skills, and an individual who has essential self-care skills such as dressing, eating, and toilet skills is considered as one who has made important progress and is ready to begin independent life. So delay in or lack of toilet skills is one of the critical issues in education of children with developmental disabilities. And independent toileting is a developmental milestone which allows and individual to fully participate in community activities, as well as develop a sense of personal responsibilities. And especially in early childhood, there are some schools that if your child has toilet skill, okay, we can accept your child our primary school. But if this child doesn't have the skill, so we have to wait for it. So it's so important for this, especially young children, because not only health issue, also social and other in other areas. So the next one is oral hygiene. According to studies, individuals with intellectual disabilities form a large group of patients with significant impacts on their overall health, mental health, and well-being. And these people face several challenges in accessing preventive services that include basic activities such as brushing teeth and dietary control, to more interactional care such as receiving personal dental care. So diet, home care, and other factors, children with intellectual disabilities development caries rate is same as normal children, but the prevalence rates of untreated caries are higher than normal children. So these children don't have this kind of habits, and some of them don't know how to brush their teeth, and some of them know how to do it, but they don't have this kind of habits. So that's why they have some oral health problems. So that's why we have to teach this skill for people with intellectual disabilities. And another skill is bathing. Our body has nearly 2 million sweat glands, and moistened and dried sweat and dead skin cells all together make dirt that sticks on the skin and the surfaces of especially underclothes. The action of bacteria decomposes this sweat, thereby generating a bad odor and irritating the skin. So this is especially observed in the groin, underarms, and feet, and in clothing that has absorbed sweat. So that's why we need this hygiene skill in our lives, and of course people with intellectual disabilities. And the next hygiene skill is armpits. Most people do not make much attention to the health and cleanliness of their underarms as much as they do for the other parts of their body. And this carelessness increases the risk of infections in the armpits and other related problems. And these are body parts that easily get sweaty and where ventilation is very poor. So after puberty, our sweat gains a specific and unpleasant odor, which may be offensive to others. So the armpits and the bottom should be washed daily. So we have to teach people with intellectual disabilities how to clean their armpits, and also how to do that on daily basis. And the next hygiene skill is nail. And nail is hard tissue that constantly grows, of course, as you know. And long fingernails tend to accumulate or trap dirt on the underside of the nail. So the dirt could be as a result of defecation or touching infected and contaminated surfaces. And so we have to keep nails trimmed and in good shape weekly. This is very important in maintaining good health. Also, clip nails, short along shape, but do not cut them so close that it damages the skin. So this is another personal hygiene skill that we should teach for these people. And another personal hygiene skill is food. We actually spend a lot of time on our feet, and our feet sweat as we walk day and night, and the sweat accumulates on all food surfaces and between the toes. The sweat may stain the shoes and can produce an awful odor. And also, another problem is bacteria, of course. I'm sorry. Another problem is fungal. Sweat also encourages fungal growth between the toes. So this is very uncomfortable health issue. So that's why we have to clean our feet daily or at least twice weekly. And another hygiene skill is shaving. Shaving is also very important, and generally we teach this skill for young men. And there's three parts of the teaching, and the first part is how to use shaving tools. You can use it electric shaver or straight razor. It depends on the comforts and which one is suitable for your student, and you can use it. And the second one is, of course, this is important to how to use it, but also it's important that how to use these tools very safely, and it's very important. Safety is so important, so we have to consider it. And also, how can we teach getting this shaving habits for this young man? Because let's imagine that a young man with very big mustache and beard, and it doesn't seem look like good. So that's why we have to teach this skill for these people. And another personal hygiene skill is menstrual hygiene skills. And the skill of menstrual care, which is necessary during the menstruation, is among the skills preparing people for life, and it is an area specifically of concern for women. Actually, girls with intellectual disabilities may take longer to learn the skills required for menstrual management, and problems may reflect the lack of understanding of the practical steps required or appropriate social behaviors. So of course, there is the possibility, but it's also possible to learn these skills. So when issues arise, like blood on clothing, pads put in inappropriate places, or disclosure or of private information at inappropriate times or places, the reaction of school staff, other students, and parents can be highly charged. So we have to teach these skills. And there are two main parts of teaching these skills. Washing the outer genital area with clean water must be a daily practices. And also another teaching part is change tampons on sanitary napkins or pads regularly. So this is quite important for young women. And another hygiene skill is dressing. We usually have two layers of clothing, internal and external clothes. And these clothes collect the sweat and dead skin cells, especially internal layers, we can say internal layers, and which can strain the clothes. Bacteria love to grow on this dirt and produce a bad smell in addition to the specific odor of the sweat. And underwear must be washed more frequently than the outer layer of clothing. And of course, there are some important points about dressing hygiene. And the first one is changing used clothes for clean ones every day is recommended. And the second one is washing dirty clothes requires adequate clean water and detergent and washing facilities. And if possible, of course, it's not must, but if it's possible, the washed clothes should be ironed to help to destruction of body lice and nits. So this is another hygiene skill. And the last hygiene skill is coughing. Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious illnesses like influenza or some kind of viruses, and of course COVID-19, because germs can be easily spread by coughing, sneezing, or talking. And also touching our face with unwashed hands, and after touching contaminated surfaces and or objects, and also touching surfaces or objects that may be frequently touched by other people. So there are 2 points here. The first point is washing our hands is a most effective way to prevent ourselves and our loved ones from getting sick. And also another point is habit of use of napkin. So these are two important points of two important parts of the teaching coughing and sneezing. And of course, there are some other personal hygiene skills like hair hygiene and ear hygiene and face hygiene. So we also have to teach these skills. But the question is, of course, these skills are so important for us, But why we have to teach for people with intellectual disabilities? Of course, I said some reasons, but this is also about how how we learn it. When we were a child, we observe our parents, we observe adults, and by observing, we learn it. We learn how to do that. We learn the importance of hygiene skills and importance of the routines of hygiene skills and this skills habits. But when we come to people with intellectual disabilities, they can learn it by observing as much as we can. Of course, they observe their parents and adults, but their learning style is not like this. They can't learn just observing as much as we can. So that's why we have to teach for them. And that's it. This is the end of this session. Thank you for listening and see you next session.